Interesting. So welcome everybody to Leo Live with Vicky Pulos. Can't believe I said Pulos. That's embarrassing. Only known you for a bunch of decades. Really pleasure to have her with us, and I'm going to introduce her as I put the what do you call it? The slides up, so you can be looking at it and as we speak. And let me go ahead and share the screen. But I'm really pleased to have her with us. She's got a wealth of experience, and she's been in her role in one way or another since the year 2000, which is pretty cool. I figured we're always here, Vicky. So, but actually there was a time, and I won't get into the other people that I worked with, but of course it makes sense because of some of the people that you even worked with, but then eventually are no longer there, but great people as yourself that always have been helpful in the field. You cover a real wide range, and in fact, let me go ahead and instead of making things up, let me go ahead and share your background with people. So she began at the Mass Law Reform Institute, and she's going to tell you about it in a minute. In 2000, and basically, she does more than this, but she looks at MassHealth and Care Connector coverage and immigrants' eligibility for healthcare programs. So basically, if you're low income or you're struggling issues, she's an expert on especially around denials and people getting just not good information from people. That's usually 70% of it. Sometimes it's just plain old on purpose, but a lot of times it's just people not knowing what they're telling people. Her prior experience, though, is Families USA, which we knew very well, which was pretty cool, in Washington, D.C. Played a huge role, especially around kids' work, but not just kids' work. Very well-respected organization. And then she was at New Hampshire Legal Assistance as managing attorney. She's a Harvard Law School grad, so she's no slouch. And she also was author of the MassHealth Advocacy Guide for MLRI. So I'm really pleased, again, Vicky, to have you with us and talk about this redetermination process. And I'm going to let you take over the speaking.
Okay. I am really happy to be here too. I have known Leo for a long time.
Oh, you just went mute. I don't know how.
Unmute myself.
Okay.
It must have been modesty, Leo, because I was just singing your praises as an advocate for people with developmental disabilities. This first slide is just a little bit about the organization where I work. It's called the Massachusetts Law Reform Institute. We work in a variety of different subject matter areas. I like to say we're small but mighty. There are just two of us working on healthcare issues. And we are a poverty law and policy center. So we work with the local legal aid programs like Greater Boston Legal Services, Health Law Advocates, but our office doesn't really do intake or do a lot of individual client work. Although we are trying very hard, especially on the subject of MassHealth redeterminations, to keep abreast of what's going on. And that involves hearing from people like you about what's going on. So going to the next slide. This is a little background information about the MassHealth redeterminations. And Leo told me most people would be familiar with this. So for the last 3 years, it's been really an extraordinary law on the books, saying that once people are enrolled in MassHealth after March 18, 2020, and that was the date this federal one of the COVID Response Acts passed Congress, once they qualify, they pretty much stay on until Congress says otherwise. And they said otherwise effective March 31, 2023. So for about 3 years, if you qualified for Medicaid for MassHealth for just 1 month, you were good. It didn't matter if your circumstances changed. They typically check data. They have people renew their eligibility every 12 months. It didn't matter if they got those forms back. They didn't even bother sending them out for the first year. None of that mattered for this kind of magical 3-year protection period. A few exceptions, like moving out of state, asking that your coverage ends. As a result of that, there are now 900,000 people of the 2.4 million on MassHealth who are protected, meaning if it weren't for this special protection, they wouldn't be getting the coverage they are. And some, returned the renewal forms, their situation had changed. Ordinarily, they might have lost their MassHealth because of the protection they didn't. But most people, the state just doesn't have updated information for them. The return rate, for the last 2 years, they've been sending out renewals. They try to do it electronically. If they can't, they send out a form. Ordinarily, we thought it was a bad return rate that only 70% of people were renewed through that process, and 30% kind of lost their way somewhere along the way. But during this protection period, the numbers have really flipped. The information we had was as of September 22, so it's not the most up to date, but at that point, among people under 65, was pretty much 70% not returning. There are only about 30% that they could renew. For the elderly and people who had to have an asset test, it was 10% that were successfully renewed. So that raised a lot of concerns about what will happen with this protection period ends, and it ended on the end of March. So that started yet another period, which is like the protection period, kind of unique. The federal agency calls it the unwinding period. So it isn't business as usual. It's sort of getting there. It's a transitional phase where there's still some special rules in effect. So from April through March, the state has 12 months to determine of the 2.4 million people in the MassHealth caseload, which is a lot higher than it's ever been before, how many are still eligible, and if they are, renew them. If they aren't, see if they can move on to other kinds of coverage like the ConnectorCare, subsidized coverage for the Health Connector, employer-sponsored insurance, Medicare, whatever it may be. The way they do this, they always start out just seeing, can we do this without having to ask people to return any information? Can we just verify their information electronically? And for the people with disabilities, a really big subpopulation are people who get SSI. That's the Supplemental Security Income Program, the welfare-based program administered through Social Security. There's also a state supplement. And people might also be getting Social Security insurance-based benefits. They could be getting 2 checks from Social Security, 1 from DTA. Sometimes it's confusing which is which, but the SSI and the state sub, because they're needs-based, you have to report what your income is, you have to report what your assets are. People who qualify for that automatically get Medicaid. So they don't really have to worry about this renewal. As long as they're getting SSI or the state sub, they're going to get Medicaid, and they'll be among this group who are automatically renewed. But there are others too. The state has a data match with Social Security. If your only income is Social Security insurance-based benefits and your only insurance is Medicare, most of those people will be automatically renewed too. You're automatically renewed when they select you during this 1-year period. You'll get a letter saying, congratulations, you're still eligible. For the remainder though, the data hasn't been enough. So they need information from people. They will send out a form. And it's been a year ago, they came up with this idea of a distinctive form to get people's attention, but they couldn't resist using it. So they've actually been sending out that blue envelope for over a year now, which is confusing when they're now saying, if you get a blue envelope, and people say, but I got one a year ago, I didn't return one. So it really is a blue envelope with a letter in it dated April 1st, 2023 or later. Those are kind of the enforceable forms that you can't safely ignore. And there is a ton of information on the MassHealth website. They have launched a very ambitious outreach campaign to try to get the word out to people. I should have had a link on here. This is the link to their main page, but there's a specific webinar up there that's recorded on how they're supporting people with disabilities, and the slides are up there as well. Their webinars are all kind of pretty much the same, but there'll be a page or two with some special supports for people with disabilities. And I'll talk a little bit about that, more about that. So this is a very ambitious outreach campaign. There's a lot of paid media. They have contracted out with Healthcare for All to hire community groups, to knock door to door. For the first time, MassHealth is really using technology more in terms of texts and emails to try to get the word out to people. So there's a lot going on in the outreach space. However, next slide, please. The outreach and how things work when you actually get to the point of wanting to communicate with MassHealth and update your coverage aren't exactly on a par. I think this photo display shows it all. So the outreach is very impressive. MassHealth does a lot of presentations about everything they've done. And it's not just outreach, they've hired a lot of new staff. They've made some other changes. If you watch their webinars, you can say, this is great. It's totally under control, smooth sailing, no problems. But then you try to get through on the phone. You try to navigate their automated phone system and figure out how to get through. You don't speak English and try to do that, or you have a communications related disability and try to do that, or you're trying to decipher the form or how to get back to the form, or even just looking at the form, and things can become a lot more complicated. If you go to the next slide, this is sort of MLRI's revised version of MassHealth's advice for beneficiaries. So the message they're saying to everybody, because remember, they're renewing over 12 months. So that isn't, until you get the blue envelope, you don't necessarily have to do anything. But the one thing that it does make sense to do is make sure MassHealth has accurate information about how to get in touch with you. And that's your address, because your mailing address, they're going to be, if you do have to return a form to remain eligible, they're going to mail it to you. But also they're texting and emailing. So if that information has changed, it makes sense to update it. Initially, all of MassHealth's publications said the best way to do it is online. If you can create an online account, and this really only applies to people under 65 who qualify without an asset test, but it's a great thing to have the online account. It's really convenient. But it turned out doing it online was a really bad thing to do for most people, because if you tried to do anything online and you were among these 900,000 people who were protected, it took you to the renewal right then and there, whether early, and you might not be prepared for it. You may have thought you were just updating your address, and then you still have time to get the envelope and 45 days to return it and help. And if you're not eligible, other pathways to eligibility. But no, that wouldn't happen. So they've changed their messaging. So now it's saying call, don't go online. You can call, you can write, you can send a letter, you can drop, but do update your information. Just don't do it online unless you affirmatively, either you're 100% sure that you're going to qualify, or you don't want MassHealth. Some people don't. They want their MassHealth to terminate. They want to go into their employer-sponsored insurance. They missed the open enrollment period. Losing MassHealth creates a special enrollment period that lets you enroll. Another really good thing for people to have, and many of your folks may have these already, is the appointment of, I can't believe I'm forgetting what it is, ARD form, the appointment of representative designation form. And this is actually a live link that goes to the form. It's on the MassHealth website. It's included in the packet as well if you don't already have one. They have another form called a permission to share information form, but they're a little different. The permission to share information says, I'm giving MassHealth permission to talk to somebody else about my confidential information, but that person can't really act for me. The ARD, you're saying this person can act for me. And the ARD will get the full packet. They will get the renewal form as well as you. And there are 3 ways to do it. One is you just designate somebody. It actually makes a lot of sense for a family with 2 spouses. As it is, one is MassHealth considers the head of household, the other isn't. If the one calls to change the address, they'll say, wait, you're not the head of household. You can't even change the address. So it's just a convenient thing for people to do if there are 2 people in the household and they both at one time or another may want to interact with MassHealth. And of course, it's really important if someone actually has legal authority to act for someone who can't act for themselves, if someone's a legal guardian. And it's also just a responsibility somebody can take on without legal guardianship. There's a section of the form where you could just say, I know this person, I know their circumstances, I can assume this responsibility of supplying information that's going to be accurate for them and abiding by various safeguards. And that also could be really important if you don't have, especially if it was something kind of unexpected that happened that left someone unable to communicate, and it's a family member and you could easily supply all the information. So that's another good thing, that it's helpful to have in advance to make sure two people are going to be getting information about the renewal. But our advice number 3, and this is different from what you're going to hear from MassHealth, is unless you want your benefits to change, and some people might be entitled to more benefits, their income has gone down or other things have changed to make them qualify for a richer benefit than they had before. And as I said, some people don't want MassHealth. But unless that's true, don't be proactive. MassHealth has reconfigured their systems. So even before you're selected for renewal, you can renew early if you want to. But our advice is, unless you're 100% sure that you're going to qualify, and that's really hard given the complexity of the MassHealth eligibility rules, don't be proactive. Make sure they have your information. If there's somebody trustworthy to also get information about you, fill out that ARD form. Otherwise, wait for your blue envelope. You may not get one. You may get the regular envelope saying, congratulations, you're still eligible. But for most people, I don't think it's a good idea to jump the gun. And there are also some problems with the way MassHealth is implementing things that we hope will be improved over time. So doing it a little later is good for that reason too. The next slide, please.
Sure.
So if you get the blue envelope, and last we heard, they announced at the Connector board meeting last week that they sent out 70,000 already. They're really going to have to do the selection. The envelopes are per household, so it's not per person, but they're going to have to be initiating renewals for like 100,000 people a month, with again half of them being automatically renewed and the other half not. If you get the blue envelope, first thing, open it. It is a daunting envelope. We actually have a live link. The pre-populated form, we scanned the contents of one of these forms and we put it on our website. We, of course, redacted all the private information. I don't know if the live links work if you were going to go there. Yeah, click now on the blue envelope, the little thing, the attachment. Great. So this is the famous blue envelope. There are 56 pieces of paper in here. It's pretty daunting. If you can scroll down a little bit on this. So this, going back to that first page, this is really the most important. Our sample is from before April 1, but on page 1, it gives you the date the form is due. So it can be daunting to get this envelope with 56 pages in it. Not all of it is the form, a lot of it is other information, but open it, look at this due date, write that due date on the calendar, and make sure that you submit it by the due date. If you just go down another couple of pages to the instructions, here we go. Yeah, stop here. So this is another really important page. This is the instruction. It tells you where the signature line is. Believe it or not, it's not that easy to find. It's on the very last page of the form. And you can see here at the bottom where it says page 1 of 40. This particular form is 40 pages long. That is short for these pre-populated forms. This was for one adult with one source of income. The more people in the household, the longer the form will be. These pre-populated forms are only for the people under 65 with no asset test. Will you scroll down a little more just to show them? Yeah, so this is how it's organized. If you go back a little where so it'll have one column saying, here's what we know about you now. where it says no data available, that basically means you didn't have to answer that question at the time you applied. And then they say, is this still right? If it is, you don't have to do anything. Some people, scary as that form is, all they have to do is kind of look through this. If everything's the same, they just go to the last page, sign it. If things have changed, they want you to change it. And if we go back to the slides now, Leo.
Oh, sure. Yep.
So, and once you get it, there are different ways of submitting it. I mean, we warned against going online just to update your address because it takes you to the renewal. But if you want to renew and you have an online account, it's a really convenient thing to have. Again, it's only available for people under 65 who qualified with that application form that doesn't ask the asset question. So for people in the DDS waiver, for example, you wouldn't have used this form. You would have used a different form that does ask about assets. And so you don't have the same online option. But if you do, it's a great way to keep track of your benefits, to know what's going on in real time, to update information, to get copies of things. So if you do have to renew, doing it online is a good idea. You can fill out the form, mail it back. You can fax it back. It's a long form. Faxing it will be a little tedious. You can get, actually, why don't we go to the next? Oh, well, no, stay here. I'm jumping around a little bit. One thing though is for some people, filling it out will be pretty straightforward, but we're advising that you get help, and specifically help from certified application counselors, people in the community. MassHealth if you have to, but if you don't, if you need to make some changes in your situation to qualify, MassHealth probably isn't going to tell you that. If you qualify with an asset test and your assets are $2,000 and the asset test is 2,000 accountable resources and you happen to have 2,500, MassHealth probably won't say, why don't you spend $500 on something, pay a bill, buy something you need, and then come back and complete the process. And there are more fancier things to do but there's some very straightforward, simple things to do if you happen to be over asset. And there are different pathways to eligibility. It may be one path is not available to you because your circumstances have changed, but a different path is, and you may have to take some added steps to qualify under that different path. So basically get help first if you just don't understand the form, don't understand how it applies to you. It's not in the language that you're most comfortable with. You need some kind of accommodation in terms of Braille or some sort of disability accommodation. The other warning is if your household has changed. If there were 3 people in your MassHealth household and now there are 2, one of the many kind of little traps for the unwary in the MassHealth system is if you report that someone is no longer in your household, they won't just be removed from your household, they will be terminated. And we're trying to get MassHealth to change that, to send those people a renewal form, because we've run across it where it's a older, a young adult was living with you, they've moved out on their own, you're also on benefits, so you're updating your application, you supply the address, you don't want your child to lose their MassHealth. You assume MassHealth will write to them, but no, that's not what happens. They will get a termination notice. The other, can you go back a little bit? So that's the household change scenario. Obviously, if your income goes over the income limits, that's another time to get some advice because there may be some other pathways with higher income limits that you could qualify for. That's especially true for people with disabilities. And one thing I wanted to particularly call out today, I don't have a slide on it, but I think most people know there's the MassHealth Standard program for people with disabilities, including people who are qualified under the DDS waiver would be a MassHealth Standard with higher income limits. But there is also a program called Common Health, which is very, very similar. It has all the same, LTSS, long-term services and supports as MassHealth Standard. And it changed in a really good way in December 2022. Before that, for children with disabilities, if they made too much money for Standard, they could qualify for Common Health. no upper income limit, no asset test, but the MassHealth would start sliding scale premiums when your income was over 150% of poverty. For adults, it didn't work the same way. Well, now it does for adults under 65. So if you're under 65, you were on MassHealth standard, now your income's gone up. It could just be a cost of living increase, or maybe you're working in addition. Well, work is a little different situation, but whatever reason, your income limit is now, your income is now too high for MassHealth standard, but you're a person with a disability as determined by either Social Security or the Mass Commission for the Blind, if it's blindness, or the MassHealth Disability Evaluation Service. You can now go right into Common Health. There's, again, no asset test, no upper income limit, just those sliding scale premiums that start at 150% of poverty. That is new as of December 2022. Before, you had to be working disabled, or you had to meet a one-time spend down, which could be pretty hard to meet. So that is one important thing for people to be reassured about. Even if your income has gone up, you should still be able to qualify. Then the other kind of point at which you want to get help is if you hit one of these ages where the rules change. So your situation may be exactly the same household, same income, everything's the same, but a page of the calendar has turned, and now you were 18, and now you're, you were 19, you were under 19, and now you're 19 or over. And MassHealth has kind of a special category for people who are 19 or 20. I know for some purposes, turning 22 is a big deal. In MassHealth, turning 22 isn't the age. It isn't one of the ages where the income changes. It's really 19 or 21. And that's where the more generous rules that apply to children and young adults change to the rules that apply to adults under 65, which are not so generous. They're both differences for immigrants and the immigrant eligibility criteria and in terms of income. And then the big change is 65. Income limit is a lot lower. Now there's an asset test. There wasn't one before. Those are the points where it's really important to understand different pathways to eligibility and make sure you're completing the form in a way that will, if the path you were on is closed off now because of your age, to follow a different path if one's available to you. So these
Vicky,
are some of the,
yeah. Can I touch basically on the 19 or 20? So the generous rules that applied up to that point, they change at 19 and 20 years old. I know we kicked that around the other day, and they changed to what the rules are for people under 65 or over 65, because I misheard you.
I'm not sure I understood, but like when you're under 19, you can qualify for standard. Actually, when you're under 21, you can qualify for standard if your family income is 150% of poverty or less.
Right.
When you
turn 19 and 20.
When
you qualify
19 and
your
20 is the special young adult category. So for some purposes, you have some of the benefits of kids under 19, but you don't have all. So if your income's under 150% of poverty, you would qualify the same way a child under 19 would. But a child under 19 can get MassHealth family assistance up to 3 times the poverty level, and a 19 or 20-year-old cannot. They have this linkage of age and income that isn't true if you're under 19.
Okay, and then how about at 21?
Yeah, that's the point where you lose this young adult status. So
Okay.
even if your income's under 150% of poverty, at 21, you'll be treated as an adult. And for adults, the upper income limit for standard is not 150%, it's 133% of the poverty level. And again, there's a change that's significant for immigrants. They're more restrictive immigrant eligibility rules for adults than for children.
And if you have a disability, the triggers.
Yeah, the only difference really with a disability is that the rules for MassHealth standard are the same, but you can qualify for Common Health. So it's not standard, but for all practical purposes, it might as well be. The only thing that's not really the same is long-term nursing home care.
Right.
And it now has no upper income limit, no asset test, just the sliding scale premium.
And if you're on the waiver, I think you've said this before, you have a higher threshold automatically.
Yes, for the waiver, it's the amount, I have it here, it is currently $27.42 per month. So compared to 133% of poverty, that's a lot more. 133%.
300% or more.
Oh, what is it as a percent of poverty? This 27.42.
We can look It's at least
Yeah,
300%.
it's less than 300%, but it's more than 200% of poverty. It's probably
Okay.
the equivalent of about 225% of the poverty level. I haven't done the math, but that looks
Okay.
roughly equivalent.
So
So
the
that's a
le-
lot.
the lesson is if you're on the waiver, don't ever get off, because that's an issue. And because someone was asking, what if someone turns 65 looking ahead for their son or other sons and daughters? And I guess, and that depends if you're on the waiver or not, right? What triggers and
There's also a waiver for people with based on age. It's actually the largest of them. It's sometimes referred to as the frail elder waiver. So it doesn't turn on having a particular health condition or being a person with a disability. Specifically, you have to be someone who would otherwise need nursing home care, but could live at home with added supports, and you're 65 and over, and it has that same higher income limit. It's actually the largest of the waivers by a lot. The DDS waivers are next, but I think there are only half as many DDS slots as there are for the frail elder waiver. And I don't think they've ever filled them. So far, it hasn't been a problem that there aren't enough waiver slots.
great.
So just quickly going then next to help, where to go for help. The next slide.
Oh, okay, that was too fast. Don't worry, we'll get there again. Sorry. I don't know how that happened.
So for help completing renewal forms, there's free assistance from people who are either, and the term navigators, that's used a lot in the health system to describe different kinds of people, but these are navigators in the enrollment world. So they, but also certified application counselors who aren't navigators, but they're all collectively referred to as enrollment assisters. They've all been trained and gone through a training with MassHealth to specifically to use the online application, but also generally to help people complete forms. One thing for people in the waiver or 65 and over, in the past, they've never been trained in how to complete the application form with the asset test. So that people recognized as a big problem going into this redetermination. So MassHealth has provided an optional 3-part training on how to complete the application, the senior application. Well, it's usually called the senior application, but it's used by younger people too for purposes of the waivers. But there's definitely not as much help out there for completing that form, which is a problem because the asset portion of it is quite complicated. But the Healthcare for All helpline is a statewide resource. They're really good. The Mayor's Helpline is good. Again, these are live links that go there. The Mayor's Helpline is part of the Boston Public Health Commission, but they actually help people statewide. They have language capacity. They can do a lot of work over the phone. They have access to the online system. They're experienced with the senior form. And then enrollment assisters are really in lots of community-based organizations. Every hospital, every community health center will have, they may call them different things, the enrollment assistance office or patient financial counselors, but they will have people who can do this. The SHINE counselors are particularly good for people who've turned 65 and also are transitioning to Medicare for help with Medicare. Some of them help with the senior application, some don't. MassHealth has been trying to recruit and support more, especially of the aging service access points, more elder service providers to help people with the senior application, but that's a work in progress. The help not so much in completing the form, but getting the form in an accessible format. The MassHealth Disability Ombudsman can help with that, whether it's Braille or they have some, there are various kinds of different formats that they can get you the information to accommodate your disability. The MassHealth enrollment centers, there are 6 of them, and this is about a year old, that they have this online appointment scheduler. It can sometimes be very hard to get through to them. but you can schedule an appointment in advance. Currently, you can't schedule an in-person appointment, but that should be available in July. And we're told the enrollment centers will help you complete a form. That isn't really the experience of people today. Are the experiences they'll hand you the form and say go away and not actually sit down with you. But we understand that is going to be changing. And you can complete the form over the phone. Now that can be a good way of doing it as well if it's, if it's straightforward. But if you need help, they're just going to ask questions and put your answers on the form. So if you need more advice, if you're in one of the more complex situations, that isn't a good idea. But if it's a simple, straightforward case, you just want to get it done, you can do it over the phone now for both the over under 65. That's new. They was allowed before for under 65. And it's new for them to do it for people who have to supply the asset information. The other thing about renewal versus applying, when you apply, you kind of want to get them all the information as soon as possible because they need it before you're going to qualify. At renewal, you're good. You've got your benefits. If it takes them forever to process them, if they keep asking you for more and more, you still got benefits during all that time. So time is kind of on your side once you meet, so long as you don't let one of these deadlines get by you. If people have already lost their benefits, I mean, that's only been even possible to start terminating people April 1st. We don't have a count of exactly how many. The Connector board meeting, they said 12,000 people had proactively gone online to update their benefits and were terminated from MassHealth and found eligible for the Health Connector, and only a small percentage of them signed up for Health Connector coverage. So those folks are, I don't know what their situation is, but that's not good. And that's one reason we're saying don't proactively do that. But if you do get a termination notice, there have also been some erroneous termination notices that have come. MassHealth has acknowledged there's some problem when people are turning 65 and going from the one system to another. I didn't mention that before, but I think everybody knows for under 65, MassHealth has one computer-based eligibility system. They have an older computer-based eligibility system for people 65 or over with that, or applying with an asset test. That's why they have two different forms. The communication back and forth between them is often problematic. So we've been told some people who have turned 65 have been inadvertently terminated by MassHealth. So terminations are already happening. If that happens, appeal right away. If you appeal before the termination date or within 10 days of getting the letter, your benefits will continue pending appeal. And find legal services to help you with the appeal. This is a link to a legal resource finder. It's really a good tool online. If you have online access, it asks you some basic information about your income, your age, where you live, and then supplies a list of the legal aid programs. It tries to keep up to date with the intake priorities of different programs around the state. So it's not wasting your time and is sending you somewhere that will be able to assist you. So that is really my tale. And I would love to hear what people are seeing, what questions they have, what your experience has been with this so far. See, there's some things queued up in the chat that I haven't looked at yet.
Let me, of course, the ABLE Act, I said, yes, you don't have to worry about assets with the ABLE Act. We have a state piece to that. I don't know if you want to say anything further on that, but,
No, if the question was, how do you report that on the form? I don't actually know.
Yeah, but it's not really a counted asset is what I want to say. You
it would be exact.
But it's not a counted asset. And then you answered the 65 question, but then Pat asked, if you are a person with a disability and get your MassHealth through Social Security, should they be on their families? This is the age-old question. Should you be carried on two insurance systems, the private, commercial, and MassHealth? And I know sometimes when people retire nowadays, it's harder to do that because it's more costly than 10 years ago, or even, and before people did do it commonly, kept the commercial and the Medicaid because it wasn't that expensive as a retiree, right, to carry the policy. But I think people are in a different situation these days. What would
I could comment on some pros and cons there, because the one advantage, it affects your MassHealth in a couple of ways. It's fine to have to have another policy, but that policy will be billed first, so your MassHealth will be secondary, which means if you want to be in managed care, you won't be in managed care. If you want to be in one care, if you want to be in senior care options as someone with Medicare or Medicaid, if you have employer-sponsored insurance, you won't be eligible for that. For people under 65 too, who maybe they don't have Medicare yet. Sometimes the managed care is a lot better than fee for service, especially in behavioral health. MassHealth is working on it through the behavioral health roadmap, but it's still true that there are a lot more behavioral health services and a lot more participating providers in managed care. And One Care and SCO have some special advantages for people. It's a restricted network, but it definitely has advantages. So that may be something you take into account. The other network issue, though, is if your insurance may cover things, and it's not even MassHealth coverage is pretty expansive, they may cover providers who don't take MassHealth. So if you want those providers, that could be a reason to go with your, to have the coverage through your insurance. But it's really sort of case by case. How good is the coverage? How much does it cost? Another thing to be aware of, though, is they won't do this if you have Medicare. But if you just have MassHealth and private insurance, you can apply to MassHealth for premium assistance. They do a little calculation to see if it's cost effective. They're looking at, will this save us MassHealth money for us to be the secondary insurer so that providers bill your private insurance first? If it is, they can actually reimburse you for some or all of the costs of paying for that.
Our experience is that's common, just FYI, I forget what you call it, but we know many people who get the whatever it is, the
premium, they call it premium assistance, and it doubles up with common health too, because sometimes people would have a common health premium, but they also qualify for premium assistance, which can reduce or offset what their premium would otherwise be.
And somebody mentioned, Marianne mentioned application counselors at South Shore are so overwhelmed with requests that they're only doing them online, but then after you leave your phone number, they do not call back. So it looks like there's been a lot of bombardment of where there are navigators or whatever we call them nowadays, application counselors. So in that experience at South Shore Hospital, we just got one feedback. So just for your
interesting. And that's why too, I think it was so unfortunate for MassHealth to there's sort of pros and cons, but I think it was a mistake that they are saying anyone can renew online before they select them, because the whole idea of the selection is to space it out so all the helpers and their own staff aren't overwhelmed with a lot of people all at once.
And
excuse me,
Tamara has a question.
Oh, okay, good. I was just gonna let you know she's had her hand raised for a while.
Hi, thank you. I have 2 questions. I don't understand. My daughter's turning 19 in a few days, and I don't understand what you said about when you turn 19.
Your daughter is on MassHealth now?
Yes, and she has a disability.
Okay, well, when probably she might be sent a separate application to see if she still qualifies. As a 19-year-old, here it gets a little tricky because there's also the income test they use also takes into account tax filing. So if you still claim her on, well, I don't want to get too personal here, so let me just make it more general. If your 19-year-old is still living with you, and if you still claim them as a dependent on your taxes, then they would actually, let me think about this on Magi. Thinking about this. The Magi income methodology generally goes by your tax household, and You know, I wasn't prepared for Magi. I have to think about that and get back to you. Their rules are sometimes, generally, they will include, they'll count the income of the tax household, but there are some exceptions for that. And I can't remember if a 19-year-old living with a family member who claimed them as a tax. Oh, no, I am remembering. Sorry. Disabled adult household rule. Okay, I'm going to start over. Now I remember. So when MassHealth adopted this tax-based income methodology, but there's an exception for people with disabilities who are adults. So first they will see if your whole family, if your adult family member with a disability, if you claim them as a dependent, ordinarily they would count the income of the parents towards that adult child. But if the adult child has a disability, they don't. There's a second calculation where they just look at the circumstances of the disabled adult child. If that child is not married and doesn't have children, they would only look at the income of that individual. And that's referred to as their disabled adult household rule. It used to be a very confusing thing where you would get one notice from one system that would say, you now make too much money. But if you're disabled, expect a different notice. And then you would get a different notice from a different system saying, no, you don't make too much money. You still qualify. I think they fixed that. So now the first computer can make the appropriate determination. This will only happen again. Our advice is still wait for the blue envelope. People are eligible until, if they have MassHealth now, they have it until they have some communication with MassHealth asking them to report back information. But it's this tax filing situation that sort of complicates treatment of an adult child. But there's a solution for disabled adult children, which really was devised to give people the advantage of this Magi methodology, which has various advantages, but not disadvantage people, especially adult children with disabilities who are still living at home and still claimed as dependents on their parents' taxes.
Vicky, I remember that fight. I feel like they tried changing something, and I don't know if it was under Governor Romney, but I remember us, I remember you.
No, this was all post ACA. This was, yeah.
That was it. That was it.
13.
Remember? Yeah. And it was a trigger. Yeah. So it was a big issue. And Sandra Hughes, Kerry, right, has a question too. Sandra had her hand up for a long time. Sandra.
Hi, it has to do with, I can basically give a leeway into this question because my son will be 21 in May 28th, but I'm his legal guardian. He's nonverbal and he has a lot of disability. The problem arose when they were changing over just in March. It became a nightmare because they wanted the paperwork that says I'm his legal guardian. So we all sent it in. I have very good, I'm actually a community organizer. So I already knew how to get that. I had an omnibus person also helping me out. And here is the catch. Because the seal from the judge and the Massachusetts didn't, because they couldn't see the seal, they wouldn't allow me to communicate with them regarding his insurance. And they wanted to put him back into some kind of crazy system. And it becomes such a nightmare. I was like, are you kidding me? I've been his legal guardian since he was 18. You all know that but it's another department. Once you hit 19, you go to another department. Then you have to send something to them. Then if you have an omnibus who is, your child is really complicated, then it gets, so you need to make sure once your child turned 18, make sure all that guardianship paper is in. Make sure the seal is there so they can see the judge's signature. Make sure they know it's permanent. Make sure and with the RDA form, make sure you fill it out. It doesn't even matter, even if that child is nonverbal. Make sure you have all those steps in places, because then it becomes a problematic nightmare for you once you have to choose a PCA or any other thing. It complicates it, and you go through this because one department, no, then you spend hours on the phone with MassHealth, and I mean hours.
Yep.
Thank
So
you,
that is-
Sandra. Thank you. Yeah, go
Yeah,
ahead.
thanks for that. That is that authorized in dealings directly with MassHealth. The PCA could be a little different, but in dealings directly with MassHealth, it's that authorized representative designation form.
Mm-hmm.
Yeah, I think it's ridiculous that they were that picky about it, especially because you actually don't have to be a guardian. That's one way of getting the authorized designation form. And for someone who's nonverbal and couldn't sign and designate you, that's another way, but, or that's not available. But there's another way where you don't have to be the legal guardian. You can just say, I am a responsible person. I am knowledgeable about the circumstances. I'm undertaking this. And you don't need the lead. There are 3 different kind of ways of being an authorized representative. So you don't even have to be a guardian, which is why it makes it especially absurd that they insisted on that. Now, dealing with healthcare providers, is it, I don't know if it was.
I think
the
that gets
PCM who was
complicated.
Yeah.
It
I
gets
would think, yeah.
complicated
Yeah.
because he has a complex care, and you need his primary care doctor to intervene and get it.
Yeah.
And not only that, they look on the fact, maybe the medication, it involves in everything. So my advice, make sure when you do not do, like she says, do not do this online, but make sure you have your doctor, a social worker from your hospital, or someone that helps you navigate, especially when you're 19 and 21.
Well, thank you again, Sandra. I just wanted one last thing, because we have to end soon, but Cherry is looking for help because when she turned 65, their daughter, who's been disabled from birth, was terminated from Medicare. And I'm not sure if that ties into Social Security too, Vicky, right? If she was terminated from Medicare, usually they go hand in hand, the what is it, SSDI, right? Or dependent.
You mean they terminated MassHealth and she
No,
qualified
they're
for
saying she
Medicare?
still has MassHealth.
Oh, yes.
So that's what's confusing. I don't know. Well, quickly, Sherry, if we can, who would you refer it to? Because I think that's going to be
I guess if it's a Medicare issue,
health.
there are some legal aid programs that have Medicare assistance projects, Greater
Health law
Boston Legal
advocates,
Services.
maybe, depending on where she lives, right?
Yeah, for Medicare, not so much health law advocates. I mean,
Okay.
they could probably do it, but there's some Medicare assistance projects, which are special projects of the legal aid offices. I know Greater Boston Legal Services has one. CLA has one. That's community legal aid in central and
Yeah,
western Mass.
CPR has one, right, in certain part of the state. Is that? or
Not
maybe
the
it's
Medicare advocacy
Not for Medicare,
project.
but Social Security.
But
Okay.
I can follow up with the referral.
She lives in the
there.
North Shore. Is CLA in the North Shore, or is?
No, that could be Greater
GBLS?
Boston Legal Services for purposes of Medicare. They have a bigger service area.
Yeah.
I
Why
think
don't
I'd
you
start with
start? Yes, right.
Greater Boston Legal Services and ask for the Medicare Advocacy Project if it's a problem around Medicare. I don't understand if your daughter was on.
It's
Yeah.
almost one, so we probably don't want to go there, but I think that's great referral. Let's take advantage of that. If it turns out to be Medicaid, health law advocates, or there's plenty of, not plenty, but there's.
Yeah,
a few.
they're good on private insurance,
Right.
on Medicaid, on medical debt, on lots of things. For Medicare, though, that I think that you're better off with the Medicare Advocacy Project.
Right.
And you know what? I realized my age thing was not very clear. I'm going to follow up with you and see if I can do a little
And what
talking
we'll
points
do?
on these age age limits.
We'll hold the PowerPoint for that. And we'll include it with the PowerPoint. We'll attach it or something. when we
Okay,
set up The
okay.
PowerPoint and the link to the tape, to the recording, because we always do that. So, okay, Carrie? I can't hear you. Can't hear you.
Sorry, I just wanted to let people know that several people, staff from the Family Resource Centers, they may be associated with through DDS. They're very familiar with, a lot of them are very familiar with this process and can also be contacted
Okay.
for questions and stuff, as well as the Autism Insurance Resource Center. They've been helpful with any kind of questions and appeals and things
So
like.
that's three. So there's three. There's the Autism Resource Center, which is tied into Shriver UMass Medical, and there's the Northeast Arc, I know, in the North Shore has a family resource center. So there's.
Yeah, they're all across the state. So
Yeah. So she
yeah.
would look it up based on her town.
Yep.
Vicky, this was awesome. This was, really informational. And of course, Vicky had asked me in advance, you didn't know some questions people might throw at me because I want to be prepared for these, And of course, we got a few and you came out on top with them, remembering especially about it's funny, the Magi, and I know it's not Christmas time, but you got and by the way, it's MAGI, and it's
Modified adjusted gross income.
Right,
yeah.
right, adjusted gross income. So pretty cool. So thank you so much. Fantastic. And I really appreciate it. You're joining us today.
Okay, well, thank you. Sorry we didn't have more time for questions. Bye-bye.
Bye-bye. Bye, everybody, and take care.